Greetings. This topic of this exposition of medical English is about risk of intussusception after monovalent rotavirus vaccination. This presentation includes investigation of the English journal American Science. First, we have to know some definitions about this topic. First, what's the intussusception? The intussusception is the penetration and osmosis of the nutrients inside cells organized beings. What is rotavirus vaccine? It's a vaccine that protects children from rotaviruses, which are the leading cause of severe diarrhea among infants and young children. We have to say about the rotavirus. What is this, what cause, and what is the lethality of this virus? This virus is highly contagious and resistant, and regardless of water quality and available sanitation, nearly every child in the world is at risk of infection. There are two effective rotavirus vaccines, rotavirus by GlaxoSmithKline and Rotatec by Merck. A vaccine has recently been developed in India. Phase 3 trials have been conducted for the vaccine.
Globally, about 1/3 of all diarrheal deaths in children under 5 will occur because of rotavirus.
CDC estimates that rotavirus infection leads to about 55,000 infants and young children being hospitalized each year in the U.S. These infections rarely lead to death in this country, but in developing countries, rotavirus gastroenteritis is estimated to cause up to several hundred thousand deaths among infants and young children every year.
Rotavirus is so common that almost no one makes it to the age of 5 without having had this infection. But in the pediatric emergency room, we see so many children who end up hospitalized. It's highly contagious. I often hear of families who have more than one child with this at the same time.
A few months ago, our 2-year-old daughter had gotten what we thought was just a run-of-the-mill stomach virus and was vomiting and had diarrhea. And she seemed a little better in the morning, and then all of a sudden she just became rapidly worse. I mean, it was just constant vomiting, constant diarrhea. And so we went to the emergency room, and by the time we got there, she was severely dehydrated.
People try to prevent rotavirus through good hand washing, by cleaning surfaces, and those are important, but the best protection for children is through vaccination.
There's actually 2 companies that make a rotavirus vaccine, and they're made a little bit differently. One product is given at the 2-month, 4-month, and 6-month visit, and one product is given at the 2-month and 4-month visit. And the reason we want to get it into babies early is that it's usually that first rotaviral infection that makes a baby so sick. Both vaccines are about 95% effective in preventing severe disease and perhaps about 85% effective in preventing moderate disease.
childhood hospitalizations for severe rotavirus by nearly 80% after just 1 year of use in the U.S. Well, in clinical studies, Rototec prevented about 74% of all cases of rotavirus gastroenteritis and nearly all of the severe cases. It also prevented about 96% of hospitalizations.
Well, carrying on with this investigation of these medicals, this investigation says that the risk for intussusception, that is a common cause of intestinal obstruction in infants and toddlers, is slightly but significantly elevated after vaccination with currently licensed rotavirus vaccines, according to the result of the two large surveillance studies. However, the studies, both published on January 14 in the New England Journal of Medicine, indicate that the overall risk for intussusception is low. They differ, however, on whether the added risk is greater with the pentavalent RV5 Rotatec and Merck, or monovalent RV1 Rotarix GlaxoSmithKline vaccine formulations. That are the vaccines.
At 3 months old, baby Luke has already had 2 rounds of vaccinations. Tomorrow he'll be amongst the first babies in the country to get one for rotavirus. He was born prematurely and more prone to tummy bugs, so it's extra reassurance for mum Victoria.
I believe that immunisation is better for Luke. I know there is always a slight risk, but with anything you do there's a slight risk, and I would rather immunise him than leave it to chance that he might get something and get really sick.
Rotavirus is so common that many parents don't even realise their son or daughter has had it. Yet it's one of the most likely causes of diarrhoea in young children and can cause vomiting, fever and dehydration. Doctors believe this liquid vaccine is the best way to stop the highly infectious bug.
It's been routinely used for many years in other countries. Overall, it looks extremely safe. It's given by mouth, a couple of drops in the mouth. It's a weakened form of the virus, which you'd be getting exposed to anyway. But this way, you're being exposed to a weakened form, so you don't get the same symptoms, but you do build up immunity.
Around 13,000 children in England end up in hospital every year because of it. The vaccine will be given to all babies between 2 and 3 months and could help prevent around 8 out of 10 cases, in the long run saving the NHS money. It's estimated that by the age of 5, almost every child will have had the rotavirus. But the experts believe that by giving this vaccine, it'll dramatically cut down on those visits to see the GP, or those sometimes distressing stays in hospital. While some parents won't want their children to have yet another vaccination, Victoria says all she can do is listen to the advice out there and trust it will help to protect her little boy. Rhiannon Mills, Sky News.
Authors of both studies emphasize that the relative small risk of intussusception should be weighed against the potentially large benefits from preventing severe gastrointestinal illnesses, hospitalizations, and death associated with rotaviral infections. In one study, W. Catherine Jith, PhD, MPH from Harvard Medical School and Harvard Pilgrim Health in Boston, Massachusetts, And colleagues look at data from the U.S. Food and Drug Administration post-licensure rapid immunization safely program. The dataset included information on 1,277,556 total doses of pentavalent vaccine and 103,9,800 doses of monovalent vaccines given to infants aged 5 to 36.9 weeks in 3 U.S. health plans. Overall, there were 267 confirmed cases of intussusception. Peristalsis, waves of muscular contractions that propel food along the intestines, are movements that are involuntary of our brains. That moves all the content of the inside of the intestine. Intussusception. What is this? This peristalsis causes the intestine to slide into itself. Now here's the presentation. Here's the movement, the peristaltis, and then the peristaltis cause the intestine go inside the same intestine beside them. This is the area of intussusception. The jejunum in cross section is a part of the small intestine. This is the intussusception. The peristaltis wave caused the jejunum to slide into itself. Now we can see that the peristaltis may cause more slide into itself, may permit flow of food at a slower rate, partial obstruction. Here comes the chemo, that this is the content of the small intestine, and we can see that stunk. Intussusception may resolve on their own and occur repeatedly of every moment of the peristaltis. Okay. The authors conducted two analyses of the data. In the first analysis, they calculated the risk of intussusception during two windows of time, from 1 to 7 or from 1 to 21 days after exposure, and compared it with a control interval of 22 to 42 days after exposure. In the second analysis, they used a cohort design including data on both exposed and unexposed person time. In the risk interval analysis, the risk for intussusception was significantly higher after the first doses of the pentavalent vaccine for both the 7-day risk window. Attributable risk 1.1, 95% confidence interval 0.3 to 2.7, and the 21-day window attributable risk 1.75, 90% that represents or the 0.2 to 3.2. There was no increase in risk after the second or third doses.
Where to find the best sites. Preventing disease and illness. Howdy. You want more information about how does the rotavirus vaccine work? These selected resources on the web might help you. The most helpful site to learn about how does the rotavirus vaccine work is www.cdc.gov. See the page titled CDC, Pink Book, Rotavirus Chapter, Epidemiology of. Here's the link. Try also our second-ranked site www.chop.edu, especially the page A look at each vaccine, rotavirus vaccine the children's. Here's the link. Last but not least, try our third-ranked site www.cdc.gov. The web page Vaccines, VPDVac/rotavirus/vaccine FAQs, CDC. This is the link.
Similarly, the cohort analysis showed a significant increase in risk for the 21-day risk interval after the first dose, but no subsequent doses attributable risk 1.2, 95%, CI 0.2, 3.2. And then, when they looked at the monovalent vaccine, however, they found that attributable risk was not significant in the risk interval analysis after either of two prescribed doses. The cohort analysis did uncover a significant attributable risk after the second dose, 7.3, that represents 95%, or the 0.8 to 22.5. The authors caution that although there was a risk signal seen with the cohort analysis, the study of the monovalent vaccine was underpowered. Thank you.